Mm-hmm. Hi, my name is Chantel Lender. I'm an RN student, and today I'm going to be demonstrating a neurological assessment. The first thing that I would do is perform wipes. After that, we would do a history collection of past medical history, family medical history, and current signs and symptoms. After that, we would perform our general survey, and then after that, we would collect vitals, which include temperature, pulse rate, the respiration rate, and the blood pressure, as well as a pain level. After that, we're going to be ready to do our neurological assessment, at which point Miranda is my patient for the day, and I will begin the neurological assessment. So I would knock on the door, I would come in, I would introduce myself. Hello, my name is Chantel, I'm an RN student, and I'm going to be assessing you today.
Hi, how are you?
I'm good, how are you?
I'm good.
Okay, so whenever I walk in, she's tracking me, she's alert, and she spontaneously responds to me whenever I talk to her. So her level of consciousness is alert and responds to stimuli spontaneously. So after that, I'm going to check her orientation. So can you give me your name and date of birth?
My name is Miranda. I was born in August of 1988.
Okay. Can you tell me where we're at today?
We're at the hospital.
Okay, and can you tell me what day of the week it is and what month we're in?
It is Friday and it is September.
Okay, so she answered all three of those questions appropriately, so she's alert and oriented times 3. After that, we're going to assess memory. So I'm going to give you a phrase to remember and then just recite it back to me whenever I ask for it, okay? So the phrase is going to be, not my house, not my fire.
Okay.
So what'd you have for breakfast this morning?
Waffles.
Okay. Where'd you go to high school at?
Redland High School.
Okay. And then what was the phrase that I asked you to remember?
Not my house, not my fire.
Okay. So her memory is intact, both the immediate, recent, as well as remote. So after this, we're going to assess speech and communication. She's been talking to me the entire time. She doesn't display any difficulty speaking. So she is speaking clearly and fluently without any issues. No aphasia, no dysarthria, anything like that. Next, I'm going to have her stand up and walk back and forth across the room. We're going to be assessing movement of both the head as well as the body. So she doesn't have an unsteady posture or gait. Her head is erect on her body as she moves, and then I'll have her sit back down, and we will continue the assessment. We're going to go through the cranial nerves, of which there are 12, and we're going to start with cranial nerve 1, which is olfactory, which is for the sense of smell. For this, I would perform a smell test. I would have her hold one nair closed, and then I would put a chocolate bar or gum or something under her open nair. I would ask her to smell and ask her to identify that smell.
Gum.
Okay, I would perform this on the other nair as well. She was able to identify it successfully, so cranial nerve 1 is intact. Next, we would move on to cranial nerve 2, which is optic. She would perform a Snellen or Jaeger test prior to this assessment, which would give us a yes or no as to whether her optic nerve is intact. For this case, we're going to say her optic nerve is intact. Next, we'll move on to cranial nerve 3, which is ocular motor. So for this, we're going to have her do 3 different things. I'm going to have you raise your eyebrows. Okay, and then I'm going to have you look up. I'm going to have you look in towards your nose, and then I'm going to have you kind of look down diagonally. She was able to follow all 3 of those commands, so it is intact. I would also check pupillary response here, but we already did that before, so I'm not going to do it again. Next, we would assess cranial nerve 4, which is trochlear. So I'm going to have you keep your head straight, and then we're going to look out to the left side, and then we're going to look out to this side, and we're going to also look down. She was able to complete those commands, so cranial nerve 4 trochlear is intact. Next, we're going to assess cranial nerve 6 abducens. So for this, again, I'm going to have you look straight forward, and then I'm going to have you look out to the left, and I'm going to have you look out to the right. And while she's looking out laterally, I'm going to look for any signs of nystagmus. I do not see any, so cranial nerve 6 abducens is intact. Next, we're going to assess cranial nerve 7, which is facial. I'm going to have you make a bunch of funny faces. So the first thing I'm going to have you do, raise your eyebrows, and then squint your eyes real tight closed, okay? Try to wrinkle your forehead, and then give me a frown, and then give me a smile, and then show me your teeth, and then give me duck face, and then I'm going to puff your cheeks out. She was able to complete all of those, which indicates that the cranial nerve is intact. If I had something for her to taste, I would also have her taste something. At this time, I do not. So then we're going to assess cranial nerve 8, which is acoustic. We're going to perform the whisper test. So I'm going to come back here. I'm going to have her cover this ear, and I'm going to speak a phrase into this ear. Brown pillows are fuzzy.
Brown pillows are fuzzy.
I'm going to have her cover this ear, and then I'm going to say a different phrase into this ear. Carmel's the best cat.
Carmel is the best cat.
She was able to successfully complete that, so the cranial nerve 8 is intact. Next, we would move on to the glossopharyngeal cranial nerve 9. So for this, I'm going to test the ability to do a dry swallow. I would touch here and ask her to swallow. She was able to perform that. I would also give her something to taste if I had something for her to taste. At this time, I do not. So we're going to move on to cranial nerve 10, which is vagus. Again, this is another swallowing test. So we would do that and test for the dry swallow, of which she completes. And then also for vagus, we would, for the vagus nerve, we would do the dry swallow, and then we would have her say ah. And then while she's doing that, I'm going to be assessing the uvula as well as the soft palate. I'm going to make sure that the soft palate is intact, and I'm going to see if the uvula rises up to be midline. So after cranial nerve 10 is intact, we're going to move on to cranial nerve 11, which is spinal accessory. We're going to be looking at muscle and tone of the sternocleidomastoid as well as the trapezius, and we're going to have her kind of shrug her shoulders and go all around. And then after that, we're going to have her turn her head to the side, and we're going to have her turn her head to this side, and then also move her chin down to her chest. And then we're going to do against resistance, have her shrug her shoulders again, and all of that is intact. So cranial nerve 11 is intact. Moving on to cranial nerve 12, which is hypoglossal, which is when I'm going to have her stick her tongue out, and then we're going to check to see if it's symmetrical, if it's midline, and which it is, and then I would have her recite a phrase, light, tight, dynamite.
Light, tight, dynamite.
Okay, so now we've completed the cranial nerve assessment. We're going to move on to the motor and function. So we're going to look at several different areas. We're going to look at muscle tone, bulk, symmetry, all of that in the deltoids, the biceps, the triceps, the hamstrings, and the quads. I could have her stand up and walk around for things like that, but we're going to save that for this cerebellar function, which is next, which is what we're going to do. I'll have you stand up to do that. We'll have you walk back and forth. So we're going to observe gait and posture. Okay, which we have good gait. She's not swaying or anything like that, so we're going to have her sit down. So after cerebellar function, we're going to go into the fine motor function. I'm going to have her close her eyes. I'm going to have her touch the tip of her nose with the tip of her right finger. And then I'm going to have her take her finger away. I'm going to have her touch the tip of her nose with her left finger, of which she completes. You can open your eyes. Now I'm going to have you take your hand in front of yourself, and we're going to have you touch the tip of your thumb to every finger that you have. And then we can complete that on the left hand as well. This is rapid alternating motion. And if she was still up, we could have her do the heel to toe test. She's already been up and walked around, so we're going to move on. And after the cerebellum function, we're going to move on to the sensory function. So she's going to close her eyes again. I'm going to touch an area lightly and have her identify it. No, just tell me verbally.
Arm.
Okay, and then I'm going to poke an area and have her identify there.
Leg. Thigh.
Okay, so after we do the sensory, we're going to do the deep tendon reflexes, of which there are 5. So we're going to go through with my reflex hammer that I have stashed for a special moment. So there's 5 different areas that we're going to assess with our reflex hammer. So we have the biceps. So we would tap to see if there's a response. And then we would do the triceps. We would do the brachial radialis. We would do the patella. We would do the Achilles. And we would do that bilaterally, so we would do that on both sides. And after we've completed the deep tendon reflexes, we would also do the sensory, the last 2, which are going to be your Babinski. So I would have her take her shoes off. I would have her lift her foot up in the air. And then we're going to take, it could be the end of the hammer, and then we're going to go against there and see what happens. And then also we would do the abdominal test, which is where you touch on the abdomen and then you look for a twitch. And after that, that would be completing the neurological assessment. And thank you.